everybody, and welcome to Coproduce Care's live stream. I'm absolutely delighted to have you with me today. This is our first live stream of the year, and it's a big one. It's a good one. We have a fantastic guest, and I am in awe of everything that he's doing at the moment, but also the fact he's able to join us despite there being so much going on, not just in social care, but also with the weather and the emergency. But we have Andy Burnham, who is the Mayor of Greater Manchester, and he is joining us this evening. And of course, you know, there's been so much going on. If you don't know who Andy Burnham is, then I don't know where you've been for the last few months, years. But I just want to show you a very short clip just to give you a flavour of his priorities in terms of who he is interested in representing in his politics. And this is from Andrew Marr, and he was asked a question about a sort of court case, that's a potential court case because of the furore over the tier system. But that's not important. Just a little taster, a few seconds here.
I would do anything to protect low-paid workers who I think now are very, very close to the edge. And I don't think they can survive on two-thirds wages. So the legal challenge applies to that. I think it's discriminatory on people in the lowest paid professions to say you can have a two-thirds furlough, but we paid an 80% furlough for people on middle incomes earlier in the year. I don't think that is fair. Straightforward, it's not fair.
All right, but
so a focus on fairness, and that I'm sure is going to come out in our discussions with Andy in a moment. But before we get to our main guest, I just want to let you know of what's coming up for us tomorrow. And we will be doing a live stream on maternity services. So do follow us and share this link to get more people into this, but also for this one tomorrow night, we're going to have Andrew Sutcliffe from the NMC. We're going to have a doula, and really the inspiration for this one tomorrow night is because well, obviously I'm personally interested in it because I'm pregnant at the moment, but also from CQC's point of view, they highlighted in their report on maternity services that there is a long way to go. So we're really unpicking some of the issues. It's a longer live stream. It's an hour and a half. So if you're interested in those subjects, if you want to look at maternity services in general, and also the alternatives of community support, and we'll be talking to a doula, then as usual, please follow us, please like and share. If you're on YouTube, please subscribe, excuse me, and get involved really with what we're doing. There's a lot coming up over the next few weeks, and I'll talk more about it after our discussion with Andy. But just as a bit of an introduction, really, most of you will know that he is the Mayor of Greater Manchester since 2017 now, but also Andy's been Secretary of State for Culture, Media and Sport, and for Health and Social, and well, the Secretary of State for Health in 2009. So that's before we had more sort of social care coming into our politics. And so really we want to talk to Andy about social care. He's had a lot of interest in social care, and we want to know why we're talking about the social care future now in the middle of a pandemic, and of course introducing the idea of a national care system. So we are going to or a service. So we're going to unpick those issues. We've had some questions that have been sent in to us by people. Thank you very much for doing that. We're going to get ready to ask those at the end of the a bit of a discussion. We're going to get into those pre-submitted questions, but also if you want to ask your own questions, then yeah, go ahead, please do that. You've got the chat. We'll keep an eye on it. And if we get some time towards the end, we'll pick those up as well. But without further ado, I'll introduce Andy to the live stream. Good evening, Andy. How are you today?
Hi, Sophie. Evening, everybody. Yeah, I'm okay. I'm a little worried, if I'm honest, tonight, because the weather here in the northwest is not great. It's wet. It's often wet here, as you know, in Manchester, but we're a bit inundated tonight, Sophie. So we're crossing our fingers tonight because there's a difficult day ahead tomorrow.
It is, and I think that there's a state of there's different levels, isn't, and there's a certain level that you've actually announced in Greater Manchester area to warn people. So thoughts are with you and everybody living there at the moment. Please do stay safe.
Yeah, it's a tough one because obviously people have the stay at home message, and for those who maybe been shielding for the last few months, it's really, really hard, isn't it, for them? They might be quite confused really with stay at home, but my home might be flooded, so really difficult issues. But thank you. We'll we will take a bit of strength from all of those wishes tonight.
Well, hopefully tonight is a bit of a diversion away from that for a few minutes, and we'll get straight into it if you don't mind. And I suppose really what I was talking about in the introduction was the idea of talking about social care now when we're in the middle of a pandemic. There's so much going on. Why do you feel that now is a good time to talk about the future of social care?
Oh, what a good question to start with, Sophie, because I think for the first time that I can ever remember in my political life, the whole eyes of the country, or the eyes of the whole country, I should say, were on social care at one point last year. And I think the state that it's in was kind of clear to people in a way perhaps it's never been clear before, particularly when care homes were facing all of the pressures that they were in the middle of last year. And I think what came over to people was this uneven nature of the system. Hospitals and the NHS has much more resource, if you like, than a social care system that often is quite neglected, fragmented, staff on the front line without the equipment that they needed. We certainly heard here in the Northwest stories of social care staff who feared that they wouldn't be able to self-isolate if they were asked to do so because of the nature of the way they were paid. I think that kind of story came over, perhaps in a way it had never really come over to all of the country in that sense before. So I think this is, in some ways, the way I put it, Sophie, is, when we came out of the Second World War, this country was kind of clear that it had to reform healthcare. Perhaps we come out of the COVID pandemic clear that we've got to reform social care. I hope so.
Absolutely. And I think for anybody who doesn't know much about social care or didn't know much about it before, this is the time when people are really feeling the impact of how important social care is, especially I think in this second wave where you've got the hospitals are under a lot of pressure. And we saw in the first wave that care homes were, for example, really encouraged to take people from hospital that were COVID-19 positive. And of course, that was catastrophic. And now we've got something different, a different situation where hospitals are looking after people, and it's a difficult situation on that side. So yeah, absolutely agree.
I think what comes over there, though, if you don't mind me just jumping in, Sophie, this is something that I've argued for many years now. They are in effect one system. I know we think about social care as a separate world, a separate system to medical care or healthcare, but they're not, are they? They are completely intertwined. And yet one system has a much higher level of funding and therefore support for staff and training and equipment than the other. And I just don't think it works to think of these as two systems. They are both critical to the care of people with high levels of need. And I have in my past spoken a lot about something called whole person care. I just think, the older we all get, people's needs become a blur of physical, mental, social. You can't separate one from the other in my view. And you need a system that can deal with all of that need without sort of separating people into saying, well, that's a social bit of your need, and this is that just does. It never did work particularly well. It's certainly not going to work in this century when people are living longer. So I think we do, in my view, have to think of this as one system.
And I wonder, from your point of view, obviously everyone who saw that pop up, that was a report, I think, that talks about what that whole system that Andy was talking about. People talk about this kind of false binary between health and social care. In politics, why do you think that this has actually occurred when in practice everybody knows how the system works or should work as one? Why do you think it's taken a global pandemic to really put a spotlight on the issues in social care?
I think it's because of the way the NHS was set up in the very beginning as a medical treatment service. If social care had been part of that original vision, I don't think we would be having this debate. It's just because of the way the service has developed over the years. Obviously, social care left with local government. The NHS then put into separate NHS bodies and organisations that have built the NHS, and a sort of a Berlin Wall, as people used to describe it, kind of grew between social care and the NHS. I think if you go back to the 1970s, I think they were more integrated actually, and then various reforms took place in the health service that sort of almost made the health service more of a silo again. So we've been, there's been various kind of periods of developments around these issues, but I just think that it's a kind of product, an accident of history, if you like, the way the NHS was built, and there's no real reason, I don't think, for organising things in the way that we do. One thing I often hear, Sophie, is that when I talk about one system and in effect the NHS having a bigger role within the organisation of social care, people hear that as a medicalisation of social care, and I understand why they would be very worried about that, and I would be worried about that, because that's not what I want to see. I think if you conjoin social care with the NHS, what you will get is the opposite. Actually, you won't get the medicalisation of social care. What you will get is the socialisation of healthcare. I think it will become more person-centred, more based in the home, more preventative. So I think the opposite will happen to what people often fear will happen. It will actually drag the NHS into a more preventative, person-centred space, and that's what I think the NHS needs.
Okay, this is. I'm glad you did mention that, because we did have a question from Martin Routledge on this exact point, and he wrote in, how do we give a proper hearing to disabled people and others who fear the idea of the NHS running social care? I don't know whether it's useful to really unpick what you mean about this sort of integration. Is it a national care service like we have a national health service, or is it slightly different? And then, how do we deal with people's anxieties about just what you're saying?
Yeah, so that is I understand that question very much so. I think the way you deal with it is by giving people rights within that system, rights to the way their care is provided, more control over their own care, and not just sort of sort of paper rights or sort of flimsy sort of commitments, actually proper rights over how people can ensure that they get what they need. So for instance, it could be the right to care in the home, the right to a single point of contact for the coordination of all care. If people were sort of really wanted a high degree of personalisation, the right to a personal budget, you could there's a whole range of ways in which you could ensure that you empower people to get what they need from the system. And when people talk about, I don't see this as an NHS takeover at all. Actually, the way I see the future would be local government in the lead with a single budget for health and care commissioning from an integrated NHS system, but often might be the NHS working in partnership with voluntary and community organisations, who would have the job of providing that informal, everyday support for people within their homes. So I'm absolutely clear you can get this right. Where I think it doesn't work is if you think of this as two systems, because what we end up with is underfunded social care, where people are left struggling at home, and then them drifting towards the most expensive bit of the system, which is the acute hospital, where all the money gets sort of trapped there. I think if you go towards a more integrated approach, you would end up, I hope, spending much more upfront on preventative care within the home, personalised care, because I think that's the way the NHS becomes sustainable in the long term.
Okay, that's really helpful. I'm going to go straight in now to some of the other questions that were submitted beforehand, and we're going to go to a video. We've put them together because it's Anna Severite and also Clinton Farquharson, and they talking about social care future. They're talking about a different conversation around social care, and also a conversation that they're hoping to open up. And as two individuals who also are in receipt of social care, really focusing on the voice of people who use social care services and putting them at the centre. A bit of a no-brainer, but it just gets lost in this conversation. And we've done many live streams on this. So we're going to do those back to back and then just let you respond to them.
Hi Andy, as a member of Social Care Future, a group of people with lived experience who draw on social care. We got fed up of being left out or on the margins of discussions around the sector and on reform, when this affects our lives or our loved ones' lives. So at Social Care Future, we have started an inquiry called Whose Care Is It Anyway?, which is led by us. My question is, what role do you see for people like me who draw on care and support to live our lives in the design and delivery of any future approach to social care?
So why do you think the system finds it so hard to share power with citizens and to work with us to use our knowledge and our ideas? And what can you do in your work to make sure that citizens are at the heart of decision making? And finally, this is an offer from us, the Inquiry Group, that we would love to discuss social care with you and your ideas and to tell you our thoughts on social care. So please get in touch and be part of the inquiry. Thank you.
So a few things there. I'll let you start off wherever you wish to start off with answering those.
Yeah, they're brilliant questions, and I agree with the sentiment that lies behind them, and indeed the name of this podcast, Coproduce Care, because I think this is where the NHS particularly has gone wrong over the years, hasn't it? It kind of makes people fit around it rather than it sort of listen and work with what people want. So I think 21st century care has got to be co-produced, to use that word. It won't work otherwise. And I think that's where we can help with devolution. So in Greater Manchester, we've got greater power over the health service. We can link it better with social care, and that is happening. I think when you build things from the bottom up like that, you get closer to people, and you can involve people more in the discussions. We've had meetings of our health and care partnership board in Greater Manchester, where we have people with lived experience, learning disability, autism, all kinds of people who are knowledgeable about their care, what they need, what they require from an independence point of view. And I found that it's such a different way of sort of building policies. The way I describe the difference, Sophie, between my old job as health secretary and my current job is this. As health secretary, I think it's possible to see numbers, not names. But as mayor of Greater Manchester, you can work with names, not numbers, if I could put it that way, in that you're closer to the ground and therefore you can build things up in a much more person-centered way. And I suppose the answer to both is that rights-based approach is, I think, what's needed, not relying on anonymous commissioners to get what you need, but actually empowering people with kind of specific rights that will enable them to shape the care that they need, and not subject to a postcode lottery, or whether your commissioner does something that the next door one doesn't do, or that's I think you've got to really rebuild the system from the bottom up, and devolution of power out of Whitehall into the big cities of the country could have a big part to play in that.
Absolutely, that's such a good point. And I know that giving more power to local authorities and devolving power in that way is something that's popular in a lot of places. I know the mayor here, Marvin Rees in Bristol, is very close to the communities as well, and tries to do a lot that's good by them. And I think that role of mayor, if you want it to be, can bring you closer to people.
Yeah, I've got a sort of a mantra that Marvin is very much that kind of person, isn't he? Bottom up people person, and I hopefully that's me too, and that's the way I like to try and work. But the thing that I would say is, and this is my, I've learned as I've gone through my journey in politics, you kind of do your role as a minister, and then you kind of see things from a different way when you come outside of the department. I just believe quite strongly that bottom up change is better change. It's better change than top down change. Whereas the NHS culture is quite top down. It's all set at a national level. And it does deal more in numbers, not names. So I just think you've got to there are some strengths in the NHS approach, but you need to combine it with more of a bottom-up, person-centered approach. There's a big difference, isn't there, between patient-centered and person-centered. I would always tend towards the person-centered is the way to go, and I think you only get that if you build it from the bottom up.
And I think that's where social care has a real strength, because it does very much look not just at the person, but also at communities. And I think the NHS is full of systems, and it can actually learn from social care. A lot of the discussion is sometimes around how do we integrate social care into looking more like the NHS. But I think we can learn from each other.
It's a bit of both, I think, Sophie. I think social care could learn from the NHS's approach to workforce. It does do that quite well, I think, in terms of the way it structures training, continuing professional development, accreditation, the standards that come with the NHS approach. I think, aren't there in a quite a fragmented, underfunded social care system. However, I think what the NHS could learn from social care is that kind of person-centered ethos. That kind of building from the bottom up, thinking more about prevention, helping people connect with what they love doing as people, because that improves their health, doesn't it? If people are supported to do what they love to do, that helps them, keep their mental health in a good place. So yeah, I think both can learn from each other. But I do come back to my point. I think that the combination of them in a single system would have the effect of socializing the NHS more than it would have the effect of medicalizing social care.
We've got a few questions in the chat about paying for social care. And there's obviously with commissioning, there's this perception that local authorities are just not giving providers, or if people employ their own staff, enough money to actually pay a good wage for people who are delivering care. Do you want to unpick a little bit around how local authorities get their money, and whether they themselves are strapped in terms of how much they can give money to providers to actually pay staff a good wage for social care?
Yeah, I mean, I just think we've got it all wrong, haven't we, on this point? Caring for someone else's brother or sister or someone else's mum or dad is for me the highest kind of calling you can answer in your professional life, and yet we treat it as the lowest in terms of the way we pay the people who do that for a living. And I just think it's a product of a system that has been left underfunded by successive governments, to be honest, including the one that I was in. I mean, obviously we probably were funding social care at a slightly higher level than happened between 2010 and 2020, but still, it wasn't enough. And it was why I proposed reforming social care as Secretary of State. I think the problem is, by funding social care in the way we do, a mixture of, inadequate government grant, local council tax raised funding, and user charges, inevitably you're going to get a huge amount of unfairness and postcode lottery when it comes to the provision of services. I would say the only way to go, Sophie, is to apply the NHS principle to all care, i.e. everyone contributes as taxpayers, and then everyone is covered for the support that they need to live their life. I mean, I just think that is the most humane, fair way of doing this. And not leaving these things to local chance, not leaving some people to see everything they've worked for just completely sort of eroded by the costs of their care. I personally think we will only have a health and care system in this country that's fit for the 21st century when it is capable of supporting people with dementia as well as it supports people with cancer. And we're quite a long way from that. And I don't think there should be any difference to that person financially. You know, if they've got dementia or cancer, they shouldn't be affected financially because they have one as opposed to the other. And yet, currently, they are massively disadvantaged if they have a form of dementia rather than a form of cancer.
Thank you for that. I'm going to go back to the questions that were pre-submitted because we've only got a few minutes left. One from Manira Thabani, and she asks, what scope do you have as the Mayor of Manchester, Greater Manchester, with your commissioning and purchasing power to tackle the inequalities in social care exposed by COVID-19 pandemic?
Yes, thank you, Manira. We do have some ability. So we have a joint commissioning board in Greater Manchester, which is a partnership between our clinical commissioners and local government. And I think what happens is when you bring those two together in a true partnership at the Greater Manchester level, you can begin to get a health in all policies approach where it's not just health in linking with social care. You start to sort of link health with housing and with work, and that's very much what's happening in Greater Manchester. You know, we did actually, I mean, just to specifically answer your question, in the middle of the height of the first wave last year, our health service, our hospitals were supporting social care with PPE. And that I don't think was happening in other parts of the country. There was a mutual aid system for PPE running across the whole health and care system. So we do operate it increasingly in that way. But in terms of the social inequalities, where this goes for me is starting to think differently about housing, starting to think differently about people's work. Why has the virus hit the poorest communities hardest? Because some of the lowest paid people have perhaps been symptomatic or asked to self-isolate, but carried on in work because they just know they wouldn't be able to feed themselves or keep themselves going. They live in homes that have not allowed self-isolation because they're so overcrowded. You know, this virus has ruthlessly attacked the poorest communities, and there are good reasons, simple reasons why that's happened. And it links to the poor nature of people's housing, the insecure nature of people's work. So we're developing health policies that go to those issues, a good employment charter, looking at standards of accommodation in the private rented sector. I think you've got to think about health in its broadest sense, I think, rather than just in terms of health and social care.
Absolutely. And that is another issue. People don't consider housing as part of the whole debate with social care.
Yeah. Do you mind if I say some? Sorry, yes, Sophie.
Carry on.
Could overrun a little past if you wanted to, but that is honestly such a fundamentally important point. When Aneurin Bevan created the NHS, he was the Minister of State for Housing and Health, and I think that post-war government understood the kind of inseparable link that there is between those two things. Without good housing, you simply cannot have good health. It's impossible. You will never have it. And in Finland, I've done a lot of work on homelessness. They have a national policy called Housing First, which basically says, there's no point paying for expensive healthcare if we're not looking after people with good housing. So sort their housing first, and then everything else will follow from that. And I think it's such a good philosophy. And I think we need to sort of to apply something similar. It's so fundamental, housing, for people living a good, healthy life, that I think, we should have a right to decent, safe housing enshrined in UK law, in the same way that we guarantee people rights to universal healthcare and universal education. You just cannot have a good, healthy life without good housing. And yet we've allowed the market, to sort of to fix this, but it hasn't done, has it? Because it's left a lot of people with expensive housing that's often not particularly safe either, because the private rented sector has such variable standards. So housing, you're absolutely right. Building health starts in people's homes, definitely. And if you live in a private rented home where you live in fear of eviction because you're on a 0 hours contract and the landlord can do a no-fault eviction, people's mental health goes completely downhill in that kind of scenario. So secure housing, absolutely. There's no health without it.
Thank you. And I absolutely, and this is something that we talk about in social care. It's the whole tapestry, and having ministers work together in their different ministerial roles or combining them. I didn't know that about Bevan, actually. So yeah, it's interesting. And I wonder whether in some ways we've gone backwards from post-war Britain that was on the kind of, the NHS, thinking about the NHS, and after the pandemic, what is going to be our legacy? Do you think that everyone's going to be competing for extra money, extra budgets to rebuild after the pandemic? There's so many different industries. Do you think that social care, it really is going to be able to get traction? And that is one of the questions that somebody has mentioned in the chat as well. What is going to be the legacy of this when we do come out of it at some point for social care?
Yeah, your point's a really important one about Bevan and the link between housing and health, because he didn't stay around long enough, I don't think, to enshrine his vision. He was out of office by 1951, and I think life would have been different if he'd stuck around. But in terms of coming out of the pandemic, I think you've got to go to what's happened. What have we witnessed? What's the evidence of what's happened? And the evidence is, it's hit the poorest communities very much harder, as I said, and that is because some people's work and housing are so poor that they don't allow them to put their health first, or in fact their work and their housing damage their health, actively damage their health. And there's just no resilience in that arrangement that they've got, to protect themselves in a moment like this. And then you kind of look to the next layer of when people enter the health and care system. We've clearly seen that the social care system is pretty broken, actually, in terms of its lack of funding and protection for the most vulnerable. So if the country was to kind of respond to what we've just lived through, I think you need to redefine levelling up. Levelling up has been kind of thrown out there as this idea of building big train lines to parts of the north and the West Country or wherever, and that is not going to level up the poorest communities, in my view. If you are serious about levelling up, you would actually go to the places where the housing is poorest, where the work is the least secure. You would start, I would say, a massive improvement program in those areas. You would improve people's homes and their communities. You would legislate to get rid of 0 hours contracts. You would guarantee people a real living wage. You would, I think, start by levelling up the social care workforce to the NHS workforce, and you would pay people on a equal pay scale. That would be levelling up, a much more meaningful levelling up to me than the one that's currently spoken about in the media. Levelling up starts in people's homes. It starts in people's communities. That is where health is built. And as we've seen, lots of our fellow citizens are living in communities and doing jobs that doesn't allow them to protect their health. And I hope, I live in hope that the country will demand those things coming out of this. I hope so.
Those are fantastic sentiments to end on. Really wonderful. And it's nice to speak to someone who's in politics, who's influential, who's also close to the community, who also gets it, gets all of those linkages of housing, of employment, of health and social care and communities. And I definitely will come back to remind you and the Severites sort of ask, if you like, to get involved with the Social Care Future initiative inquiry that they're doing. So hopefully you'll be able to follow up with them, because that's
they definitely should. If they could get in touch, and we'll facilitate that, and I'd absolutely would love to be a part of that. But thank you for what you said, Sophie. Thank you for letting me being a part of this tonight. And I kind of felt when I left Westminster, I kind of stepped outside the sort of the normal party politics. I'm just kind of interested now in how do we fix some of these fundamental things that are wrong with the country. And I think we do it by adopting more of a place-based approach to this, building from the bottom up. And I think there's a growing number of people who I think see it the same way. Let's not always see things through the divides of the political parties. Let's sort of like, you know, put power in the hands of people in communities and build things from that place upwards. And I think you'll get better change in that way.
Wonderful, so refreshing, and a lovely diversion from all the horrible news that we've got at the moment.
I'll go back to the flooding now.
Yeah, well, good luck with all of that.
Nice
and thanks again for joining us.
Thanks for all your questions.
Take
all
care.
the best, everybody.
Bye-bye.
Bye.
So there we go, Andy Burnham. I really enjoyed that. I hope you did too. And of course, if you want to watch back, you can just rewind and watch back as much as you want to, or share, or even if you're campaigning in any way and you want to say, well, actually, here's a mayor, a politician who's talking about housing and employment, and I like the idea that between the contracts between NHS and social care. That's something I would love to see happen for social care workers, that parity. So absolutely, just keep this conversation going. Yeah, I really, if you did like it, please remember thumbs up, because if you like it, makes us feel loved. Remember, a lot of us are just offering our time up free to put all this together. But also just to remind you, sorry, I have got a cough. It's not COVID. It's to do with my silent reflux, if you're wondering. Yeah, so tomorrow we're going to have a live stream about maternity services. Again, if you like and if you subscribe to our YouTube channel, click the reminder, you'll just find out about that. And do please join us. Some of you may think, what's this got to do with social care? But actually, social care is very gendered. There's a lot of women who work in social care, and also it is about care as well. There's community midwives. There's people who support people who are in networks, and we're going to really expand the conversation and the different options for people. And also, I wanted to kind of bring to your attention the idea about vaccinations and vaccine hesitancy. We're organizing at the moment to do a webinar with professionals. We've reached out to immunologists, we've reached out to virologists, clinicians, the BMA. So we've got quite a few people from GPs from the BMA, British Medical Association. We're going to have them on a panel, and they're going to answer your questions about the vaccine. So anybody who's thinking, should I take it? What's in it? Why should I take it? We just think some of the best ways of actually supporting people to make the right decision for themselves is not just to be told by people on TV that they need to take the vaccine because it's good for them and good for everyone, but also to have their questions answered. So to ask them and to have a specialist answer them, and of course for you to find out whether it's still right for you or not. So that's going to be in February. We've had some great support from clinicians helping us with that. So we will be reaching out to you all to try and get you to engage with it. It's going to be live. It's going to be a Q&A. We're going to do the usual, stream it here on YouTube, on Facebook, and on Twitter, so you can ask your questions on any of those platforms. And we will just spend maybe an hour and a half answering question after question. So if you know somebody who's not sure about the vaccine, who has a question and really doesn't have anybody to answer it, who they trust or think is a specialist, then please do engage with that. It's not going to be until probably the first or second week in February, but maybe the vaccines wouldn't have reached you by then anyway. So we're hoping it will be timely, or you're just about thinking and eligible for the vaccine at that point. So that's enough on that. I think we've pretty much gone through a really good session today. I hope you've enjoyed it. And of course, do share and take part in any further live streams that we do go live with in the near future. So take care, everybody, and we'll see you tomorrow night. Take care.